Hi, my name is Dr. Isabel Camandra. So today I'm going to go over the ways that we use our digital scanner. So this machine can take a 3D model of our patients' mouths and we can have it on to look at on the screen within seconds, really. One of my favorite ways to use this machine is for restorative or crowns and bridges. So traditionally, when we're doing a crown or a bridge, we have to prepare the tooth. Then we have to take a mold. So those impressions that have the gooey material, those annoying trays that sometimes pinch your gums. So instead of the impressions that we conventionally used to do, now we just use this wand and there's a little head that goes in the mouth and it just scans. And there's no material, nothing. So it's much easier for the patients and I would say easier, less messy for us as well. One of the best ways that this can actually help, I do feel like it makes me a better clinician because I can actually look at my work right away. So I get instantaneous feedback if let's say my crown prep needs to be adjusted, if there's enough space, if we need to adjust any of the other teeth. It gives us instantaneous feedback. Those colors that you're seeing on the screen, they show where more of the biting pressure is. So you can see how the occlusion fits together. And then if we take that away, we can also see how it looks with the opposing arch. So when there's a top and bottom there. And now we can see for sure this tooth is ready for the crown to be made. The other really good benefit of this is it's actually a lot more accurate than those traditional impression materials. The impressions are prone to distortions. And the good thing about the scanner is you can send this information immediately via Wi-Fi. So instead of having a lab come, pick up the models, pick up the impressions, pour them, etc., this just goes via Wi-Fi. And we even have a machine here in our office that we can use to make crowns. So we send this to the machine in the back, can make the crown within about an hour and a half. So things are getting a lot faster, a lot better, a lot more accurate. One of the other really cool ways that we can use the scanner is called the time-lapse feature. So we're going to compare a scan of the same patient over a certain number of years. So if we take a scan one day, years later take another scan, you can actually kind of superimpose those two scans and see if there's been any changes. This is actually a scan of myself comparing from 2017 to 2021. So let's take a look. Any of the colors are showing where there's more of a difference between the two scans. So all in all, not too much difference, but if I zoom in on this area, and here's where it shows you the changes. So over this period of time, the one thing that I can see that's different, I have had a little bit of shrinkage in the gums over time. The other thing that this can show sometimes is, let's say there's a chip or wear. So here I had some bonding on the lingual wire. It looks like a little bit has chipped off since then. So we can see changes in fillings. We can see changes in the wear patterns of the teeth. Have we been grinding our teeth? Have we been chewing on certain things, causing chipping, causing wear, whatnot? Have teeth been shifting? Have there been more spaces opening up, more crowding? This is a really cool tool that we can actually visualize that. So another feature of our scanner is just the ability to view the occlusion. There's not really any other way that we can instantly see our mouths from the inside view. We don't really get this view ever unless we were to pour up the models, but that's a really cool feature to see how the teeth come together. The other thing that's really interesting is, so we can see all these different views simultaneously, and then we can also use the occlusogram feature that shows, so these different colors are showing where there's closer, where the teeth are touching more, I should say, where there's heavier contact. So the red marks indicate closer contact, and then the blue or lighter marks are a little bit more space between the teeth. Ideally, we actually want more of the red, heavier contacts on the back molars because our back molars are bigger, they're stronger, they're made to withstand more pressure. So anytime we do see a bit of red more towards the front teeth, it's a sign that those teeth could wear down a little bit faster.